Thank you. Good morning, everyone. We'll get the governing board meeting for the Department of Health Facilities and Outpatient Community Programs underway. If we can just go around and introduce ourselves, I appreciate it. My name is Gabrielle Sanchez-Sandoval. I'm Deputy Secretary of the Department of Health.
Abhinav Shachakar, Deputy Secretary of Health.
Wanda Walensky, and the Office of Council.
Todd Winder, Administrator for Fort Worth Medical Center.
Jose Barola, Hospital Administrator.
Shauna Hartley, Hospital Administrator.
Jason Corma, I'm the Chief Operating Officer for the Las Lunas Community Program.
Roberta Vito, Facilities Fiscal Officer.
And Angela Solis, Office of the Secretary.
Michelle Fields, Medical Staff Office.
Francis Tweed, Administrator at NMDOH.
Georgia Letta, Nursing Home Administrator.
Jeff Esquivel, Application Support Manager for DOH Facilities.
Carmela Sandoval, Support Analyst, Treatment Center Administrator.
George Morgan, Deputy Director, Administrative Services Division.
Charles Hanalino, CFO.
Do you want to come sit up here? We just started.
Chris Novak, I'm the Television Medical Director and acting or interim medical executive team.
We just really quickly, first we're at the beginning of this new year and the new administration with our Governor Michelle Grisham. And I just wanted to, we invited our Deputy Secretary Abhinav today just so we can understand some of what facilities do and get familiar with this side of the department. He is overseeing public health division, epidemiology and response, scientific labs. So, yes, CHI, yes, I forget. and OPA. And a couple of other things that changed. Of course, we have a new Cabinet Secretary. I think some of you may know her, Kathy Kunkel. She wanted to come today, but actually all of the Cabinet Secretaries are going on a retreat for 3 days. So she's doing that with the new governor. And we also have Dawn Hunter is still with the Department of Health. She's just operating in a different capacity. She's over the policy office. So she's leading all of our legislative initiatives and tracking all of those that come in. We have a few more exempt positions in the Department of Health, including our Public Health Division Director, our Administrative Services Division Director, and our Public Information Officer. So there will be further announcements coming out as those staff join the department. So I'm very happy to still be with you guys. As you know, it was very tearful for me at the end of the year, but I'm very excited and grateful that I still get to work with you guys. So we'll just get this governing board started. And can I have a motion for approval of the agenda for everyone to have an opportunity to look at it?
Change
Okay. Is there any other concerns about the agenda? And if not, I would have a motion to approve. Can I have a second?
Second, Francis.
Thank you. The approval of the agenda is noted. And has everyone had an opportunity? You all should have received this packet electronically, which included the minutes from the last governing body meeting. Does anybody have any changes to the minutes from the last governing body meeting? Seeing none, can I have a motion to approve those minutes? And can I have a second, please? Second. All those in favor? Aye. Anyone opposed? That motion carries. We're going to, of course, go to our new business reports. I already mentioned where our Cabinet Secretary is. I don't have any other news to share at this moment, so we can jump right into our facility administrator reports. And I will just ask you, as you're giving your presentation, to make sure that you're looking at and signaling for our IT folks when to go to the next slide. Of course, their backs are to the slides right now, so they're gonna be looking at you as they move through the presentation with you. We'll start with the Los Lunas Community Program, and it'll actually be Jason Cornwell presenting for us as opposed to Tammy, who's out.
Thank you, Deputy Secretary. My name is Jason Cornwell. It's my first governing board meeting. Pleasure to be here. As I said earlier, I'm the Chief Operating Officer for the Los Lunas Community Program. Los Lunas Community Program provides 5 essential services, the first being supported living, the second is crisis residential, third, customized community supports, most folks know it as rehabilitation. We also provide community integrated employment, and we also have an intermediate care facility for individuals with IDD. Current census, supported living, we are serving 60 individuals, crisis, we have 1 person. In CCS, we serve 57, and CIE, we serve 26. Currently, the ICF is unoccupied. Out of our census of 60 individuals, 34 of those individuals are Jackson class members. As I said just a moment ago, the ICF is currently unoccupied, but all of our deficiencies from the December 2017 HFLC report were corrected. It's a yearly survey, so we are waiting for that survey anytime now. There have been no DHI Quality Management Bureau activities for the previous quarter. The individual quality review, most folks know that as the Jackson class review, that's headed by the court-appointed community monitor. Within the last quarter, we submitted all of our documents for the document request. They came out, we had 8 individuals in the sample. They concluded all of their interviews and site visits, and they issued the final reports. We had an opportunity to sit on the 10th of January and answer to all the deficiencies that they were noted in the report. The meeting went very, very well. We were able to close a number of recommendations at that meeting, and we should be able to close the remainder of the recommendations within the allotted time frame. Our financial update, our numbers there are on the board. I won't go through them all, but we're keeping our head above water at this point in time. There have been a number of facilities projects that have been happening to the campus. We are improving the exterior lighting to better meet the safety needs of the occupants. We are also exploring renovating the campus entry guard shack, bringing electricity to that, having a person that can come and people sign out so that we can track who's coming on and leaving the campus. The campus beautification projects are all ongoing. I was talking to the maintenance crew just last week, and they fixed all the fencing to the cemetery. They are fixing the irrigation. They're making sure everyone's headstones are visible and not covered by dirt, so it's really looking nice. All the improved traffic signage, stop, speeding, caution. I think our speed limit is 12 miles an hour on campus. All that stuff's up. And then we recently restriped the parking lots with the required ADA and parking spaces. All that's been done. Our HR update. When we are completely hired, we run 295 individuals. Right now, we have 220 staff members for a vacancy rate of about 28%. We have 8 individuals on workman's comp, and 28 individuals are certified for FMLA. Some of our performance measures, the bar graph on the left, the A&E allegations for FY19. Right now, we had 2 for September, 2 for October, and 4 for November, for a total of 8. These allegations are called in. When in doubt, report is the training. So just because they're reports doesn't mean that they are substantiated or actually allegations of abuse, neglect, or exploitation. Our number of med errors for the amount of medication that we give on a daily basis, our number of errors are extremely low, so that's good. For falls, we are constantly examining why individuals fall, what can we do to support them, whether it's personal support technology or environmental modifications. So you can see the numbers are trending downward, which means our people are doing better. And we've only had 1 elopement, and it happened last fiscal year, so there have been 0 this year, which is a really great thing. We had a couple of special events. There was a Halloween, party, people dressed up in costumes. It was a lot of fun. It was a little before my time, and then I was at the Christmas party on the 14th. It was held at the Las Lunas Railroad Station in the room there. About 100 people showed up, individuals, staff, case managers, and family members. Santa came, passed out gifts. We had an ugly sweater contest. It was a lot of fun. The staff had a really great time, and it's just one of the opportunities that we're trying to create to give back, boost morale, and let people know that they're appreciated for the work they do. One of the bottom pictures, that's us in the back serving the food. You know, people cooked ham and turkeys and fasole and all this other stuff. It was a really great time. Are there any questions about LLCP?
Questions for Jason?
How long have you been there? I started on November 5th of 2018. Prior to that, I was with GDSD for about 2 years. And prior to that, I was with the Quality Management Bureau, NMDOH, for a little over a year as well.
I'd like to make a comment, just to let you know, Jason, that for period payroll 12, your overtime was at 87, which is really good for what we talked about this week. So I'm glad that you guys are still monitoring it and so forth. The payroll 13, you really won't have that good of a gauge because those following 3 payrolls, they have holidays. So we just want to be quite
Thank you.
Seeing no further questions, thank you, Jason. We'll move to the next topic, you don't have this.
Yeah. Good morning. I started with our divisions. We have 5 distinct divisions at NMDOH. Adult Psychiatric Division, which is what I think we're known best for. Forensic, and then we have our care program, which is a 20-bed adolescent program. That program is for adolescent males from 13 to 18 who have exhibited sexually harmful behavior and who have perpetrated against usually a family member. And that's a year-long program. And then we have our long-term care division, which is run by Susie, and that's 176 beds. We currently have 163 operational beds. And then we have our outpatient program, which is community-based services. Our average daily census, I have a breakdown here for the total for the facility was 257. APD was 76. Forensic is running around 48. Care only has a census of 5. And then long-term care is at 128. Our outpatient program, they currently are serving about 1,025 clients. Psychiatry has 974, psychotherapy 138, 16 are CCSS, which is a case management program, and then our psychosocial rehab has 26. My report for Joint Commission licensing and the fire marshal. There were additional ligature findings in our common areas when they returned to clear us from the first survey. And the reason that we got hit the second time was because in the meantime, we're one of the first facilities that was surveyed under the ligature project. So they decided that they needed to look at additional areas. So that's why we had second findings, and we completed that project on December 14th. The cost for that project was $338,000. And they're going to be back at any time. The last visit was not unannounced, but this time it is going to be unannounced, and we called and asked about that, and they said that when they visited us last time, that was the last announced visit. So we check every morning at 7:30 because they'll show up at 8 o'clock. So we're waiting for that visit. And then the care unit received another extension for their annual certification survey, and part of that reason is because we have a project, capital project going on at the care unit that I'll talk about it in the future. And our window is open for our annual DHI survey at long-term care. We did have our annual fire marshal inspection in November, but we're still pending findings. But we were verbally told there's not any major findings, so that was good. Our budget, our total projected operating budget for this fiscal year is just a little bit over 56 million. I broke down the general fund and the other revenues, and we are within our budget. Our projected uncompensated care for the quarter is a little bit over $5 million. The contract cost for this quarter is at $1.2 million. That did go up a little because of our lack of site techs. Our second quarter collection rate is at 89%, which is where it's been last year, and we are trying to work on trying to get that up. And we do have 3 vacancies in our finance department. We are lacking a data processing supervisor because she got promoted to the deputy finance director position, so now we need to replace her. We also lost a biller to outpatient, and we have an insurance follow-up clerk vacancy. So we find that we constantly are having vacancies in the billing department, which I think does affect the collection rate. Our capital projects, our nurses stations at our adult psychiatric division, that was a finding during the second survey. However, we weren't cited on it, but what we've decided to do is that what they're saying is there has to be somebody posted at the nurses station at all times, or you have to have it contained so patients can't get in there. So we're working on RFP for a redesign of the nurses stations, and George is involved in that. And thank you, George. Of course, he's involved in all of this. And our roof replacements continue. We had a kickoff meeting yesterday for the mail room, and that's in process today. Hopefully they'll be done by tomorrow. And we still have a few more roofs that we're working on. Our Meadows Phase 3, the pre-construction meeting is actually scheduled for February 1st. So that's good news. And then our APD HVAC replacement project is scheduled to begin, and we're planning that now, but we're waiting for the Joint Commission visit before we start moving patients within APD, because that means we're going to have to vacate 5 different units. It's going to be quite a production. We're going to have to do 1 unit at a time, and we're projecting that probably by March we'll get that started. And then our asbestos abatement at the care unit, our Zia building, is scheduled. We're going to be moving our residents to the Crestone building. We finally did get approval to do that through CYFD licensing. They're moving the day after Martin Luther King Day, and then the following Monday, we're anticipating that that abatement will occur, and it's going to take probably 2 months is what we're anticipating. Then we'll be able to go back to the Zia building. The Meadows compaction concrete project was completed. We had called that the sinkhole, but we decided that Meadows compaction sounded better. And we are working on, during Phase 3, they're going to be doing some repairs from Phase 1 and 2 that we have found. So we're working with FMD and George closely to make sure we get all those repairs done. And then we also have an RFP going out for life safety drawings for all of the patient care units, and also an ADA compliance assessment that we need to do, because when we have our next Joint Commission survey, which will be in probably August of 2020, we're going to have to be ADA compliant, because we're going to be asking for a deemed survey. HR information, this month I decided to list how many we hired and how many we dismissed, because it seems like we hire, and it looks like for the quarter we're 1, so it'll take us a little while. We're 1 ahead, but we're diligently working on it, and we are, recruitment and retention efforts. We continue to have rapid hires, and we have the next one scheduled for February the 4th, I believe. And for our rapid hire that we had in October, we hired 14 techs and 3 nurses. And then we had another one December 1st, which was on a Saturday, and we were able to hire 16 techs and 4 nurses. So we're really making progress with the nurses. Our vacancy rate has dropped down to 16%, and it's been running about 28%. So we've been able to really hire nurses with that, the appropriate placement. So we're really grateful for that. And as far as recruitment efforts, we continue to really focus on our shortage of techs. We continue to meet as a committee to see what else we can do for retention. Our staffing ratios have been revisited again, and we were able to look at some of the units, especially during the evening and night shifts. Our ongoing interview process is implemented, which means that we interview new hires at 30 days, 60 days, and 90 days. And that's really worked well. We're going to have a meeting soon to go over some of the findings, what people are saying as to why they're leaving. We have been able to hire part-time techs. We were able to identify additional positions And during our December rapid hire, we were able to recruit some students that can work on the weekends part-time. And then we're continuing to closely monitor our level 1-to-1s. We've asked our medical staff to please always evaluate them every shift so we can get them off level 1s as soon as possible. And then we continue to allow our techs who are on mandatory overtime to leave early whenever possible. Our performance measures, our occupational beds are at 74%, and I think that one of the things that's making that 74% is forensic, but we really do want to keep our census at forensic low because there is no reimbursement. And our vacancy rate for direct care positions is 33%, and I did mention that our collection rate is at 89%, so we're not at our goal of 92%. What our patients are saying about us, we do ongoing surveys at APD, care, and forensic. And you can see that this is just some of the questions that we ask the patients. At the adult psychiatric division, when they're discharged, our patient advocate completes the survey with them or offers to if they need help. And we have had really good results, up to 90% on most of our, actually nothing fell under the 90% this last quarter. Our training initiatives, the big one is the USP 800 training. Dan Smith, who's our pharmacist, is going to be spearheading that project. We identified a performance improvement team to start working on what we need to do because that's going to be in effect this December. And what it entails is the disposal and management of some of the psychotropic drugs, and that's going to have a big impact, and also the chemo drugs. So it's going to really impact every healthcare facility. So we've already done training for management, for nursing councils, supervisors, managers of the departments that are going to be effective, and we've identified a team of people from all the divisions that are going to be effective, and they've been given assignments as to what they need to work towards. And at our weekly management meeting, Dan's been giving us updates as to how they're doing. We had training on ligature risks because one of the things that we found out is in the common areas, if an area is not ligature resistant, you have to have what's called the 3 S's. So the area has to be supervised at all times. The doors have to be self-closing and self-locking. So we have already made those changes, and we've done a lot of training with all the staff at APD to make sure everybody's aware of that. And then we did training on the 5 types of evacuation, and that's for all, by our safety department for all employees. And we did have 6 employees attend the RFP training in Santa Fe in December. And then the New Mexico Public Health Policy Forum was attended by 2 of our managers. And our RN educator, who's new to his position, became a CPI instructor who became certified. And then we did have 4 of our supervisors attend the DOH manager and supervisor training that was hosted by David and Markwood. And it was really an excellent training. I tell you, we had such good feedback. I had a few people that didn't want to go. Why do I have to go? I'm a good supervisor. Are you targeting me? Came back and just really excited about the training. It was really interactive. So we're hoping to get to have more of those trainings, and we already have some people that want to go. Community connections, I'm pictured here in the office with some of our Patient Foundation board members. They actually donated $3,500 for our patients for Christmas, which equates to about $10 per resident, and they do that every year. Mike Montoya on the left, he's our president of the foundation, has been president for many years, and Kathy and Jake are with him also. We have additional members that weren't able to attend that meeting. And then Dan Smith attended the MNCAP advisory board meeting in October. Our care residents, which is continued to volunteer at our local soup kitchen weekly, and we have students from the United World College that volunteer weekly at long-term care and also at our care program. And then CBS attended a health fair in Santa Rosa on October 19th. And I've listed some of our activities for the quarter. In October, long-term care really focused on chili roasting, tortillas. So they were really, it was focusing on the harvest. And then they did public.
The tortillas. Green chili and tortillas, fried. I mean, I would have been there. I was gonna let that
For the whole month. And they actually, we have a really good room where the residents can go cook with the activities people. So they were able to make tortillas, and they were able to roast the chili. So it was really nice. And then for Halloween, they did pumpkin carving. They had a Halloween party and they had dances. And then on Sundays, they had football parties. Outpatient community-based services, they had a Halloween, they celebrated Halloween with the costume contest and games, trick-or-treating, and they had a pizza party, and Thanksgiving meal was served, and Christmas was celebrated with a Christmas Eve party. They had Christmas-themed games, holiday charades, and 12 days of Christmas poem trivia, and all that was for the patients. This is all for the patients. And then they had holiday bingo. And then at adult psychiatric, for the patients, they had a salsa contest eating. That would have been nice too, right?
Yes.
And one of our winners is featured here with Jonathan, who's the supervisor for the APD and forensic activities. They had a pumpkin social at the farm, and they had a Halloween pizza party, and then Thanksgiving Day bingo, and they had a Christmas party and dance. At CARE, I really want to recognize Yvette Anaya, who's a budget analyst at Department of Health, who coordinated gift giving to our residents as well as Sequoia. And it was just amazing what they came up with. So I really need to thank everybody at the Wellness Building. And she spearheaded it, so she came with IT when they came to visit us. And I could not believe, and there's a picture of all the gifts that she wanted, a picture of the gifts. So that's how many gifts were donated. So it really made a difference for our kids. And then they also had a pizza party. They participated in the Tomato Fest, which is part of the salsa eating contest. And a Thanksgiving meal, they were able to go to El Sombrero, who gave them a free Thanksgiving meal. And then they attended the Pohaki Pueblo tribal ceremonies on the feast day in December. So that was really nice for the CARE kids. Forensic, they had a Halloween party that included bingo, and they won prizes from the canteen. Patients worked together and they prepared the activity calendars for the unit. So I have pictures of the calendars that they came up with. If you notice, the one of them had footballs. I believe that was December or January. And they had Christmas movies, and outdoor activities were also offered. For our employees, every year Health Information Management has an Employee of the Year. So they celebrate that every October, and pictured here, there were 4 people that were nominated, and they are actually nominated by their peers. Adelina Pais-Juan was selected by her peers this year, and then Nicola Beta, Loretta Gonzalez, and Evelyn Luceros were runners-up, and pictured with them is HC, because they report directly to us. Every October, let's see, the finance department for Halloween also dressed up. So we have pictures of some of our finance department. And then dietary had an employee appreciation day at the dietary department. And pictured here in Las Vegas, we have the east side and the west side rivals. So one of them in the picture was the Dons and the other was the Cardinals. So that was really cute. That's why I selected that picture. And then the pharmacy celebrated with the students with UNM and University of Colorado for Christmas. And then CBS also had an ugly sweater contest. So there are the winners. That's my presentation. Are there any questions?
Thank you.
Thank you.
I just want to share that my first job at NMDOH was a rec leader, and I got to make some deals with the long-term care residents. That's what was my job, and it was fun. We had cooking, but that was my very first job 25 years ago. So anyhow, my presentation for Sequoia Adolescent Treatment Center. As we all are aware, I'm a 36 bed. We provide services for adolescent males, 36 bed between the ages of 13 and 17. We provide services for residents that have a history of violence, a mental disorder, and are amenable to treatment. You'll see the first table here is our average census. Our goal is this fiscal year has been 30. We have not been able to reach that for a couple of reasons, we believe. However, we're slowly, gradually trying to get there. So we increased our average this quarter. We are expecting our survey now in this upcoming quarter for licensing and certification, with our goal being another 18-month certification. Our health department started doing unannounced surveys, and they do that twice a year. This year they completed it in November, or their biannual, they completed it in November, and this was the first time that we received a deficient free audit of our kitchen, and that's in the 5 years that I've been there. So I was really excited, or we're very excited about that. We also completed some inspections for our fire system, our risers, our sensitivity tests, and our pharmacy. We all did very well on those as well. Our financial and capital projects, we are in the process of removing our swamp cooler in our kitchen and replacing it with an HVAC system. That's in process. We recently completed our cooling system in our serving room. We completed that. In process is our upgrades to our video surveillance system. And we also completed our grease trap replacement. We repaired and replaced that. And financially, our revenue or our budget is of $3.8 million. We're working collaboratively with ASD monthly on our budget and making strategies to balance our budget. This quarter we've increased our average monthly census with our goal of being at 30. Our DON is successfully managing our nursing contract, and I think we strongly believe that we're going to stay within our budgeted amount and not request for additional monies. We're doing this by not allowing our agency nurses to work overtime. And we've only had to use overtime this fiscal year so far just for the November and December holiday. And so that's been a success. And we're also trying to monitor our overtime as well overall for the facility. Our human resources. Our vacancy is high. Currently, Sequoia and Turquoise Lodge share a human resource position. We just received approval this week to hire Sequoia to hire their own human resource position or supervisor. So we're hoping that that's going to assist us in hiring or processing our hires quickly. So I do appreciate sharing with Shauna that we are getting our own, and we're excited about that. And we're trying to navigate through the hiring process, but we're really trying to work on our vacancies and considering the rapid hire now this next upcoming quarter. Also, Sequoia is working on identifying opportunities to bring training opportunities for our staff so we can strengthen their skill set. And also, this also builds retention of our staff. All our therapists are going to receive a functional family training therapy, and they're getting certified. Out of our 5 therapists, we've completed 3 of them. The trainer is also continuing to look at opportunities. Recently, we identified an opportunity to, instead of having CPI in smaller groups than larger groups, and try to focus on the incidents that we're seeing more frequently, that's fighting between the 2 residents or fighting among the residents. So we really focused this quarter on having small groups training on how staff can break up a fight without having to use a CPI hold. So that's been really successful. We're utilizing the techs with the nurses and the therapists all as response teams for this and to address it. And we've been very successful, and you'll see that on our restraints data. Our performance measures, we're, among other things, these are the 2 areas that we're reporting as our restraints. You'll see that our restraints monthly for this quarter have been very low and continue to be very low. And they've all, the average of have all been less than 15 minutes per hold. Our facility does not use mechanical restraints. The restraints that we're tracking here are just holds when we have to intervene more typically on a fighting when the residents fight with each other. Also, we're tracking with the care unit at NMDOH our successful discharges. And you'll see our rate there, our target rate is 80%. In December, we had 100%, but the other 2 months, we didn't meet, so it's brought our average to 73%. Also want to echo Francis's appreciation for Yvette at the Reynolds Building. We also benefited, the residents at Sequoia benefited from their support or their sponsorship of our residents. Each of our residents were able to get for Christmas a gift bag with t-shirts, hygiene items, underwear and socks, and they were very excited. They woke up to Christmas. I had at least half the residents say that that's the first gift that they've gotten a year plus. So that was exciting for us as well. I want to thank Charles for that support as well. You'll see our next picture of our gifts that they received. We also participated in Coats for Kids, so all our residents were able, KOAT sponsored our residents, so all our residents got jackets or reused jackets, and the same response. We had kids that aren't even wearing jackets, so all of them have a jacket and they're warm. Any questions?
Thank you. Getting to rehabilitation center in Jose.
Hello, Jose Corolla Hospital Administrator for New Mexico Rehab Center. For NMRC, we continue to provide our core service provisions on our 2 separate units. Our inpatient medical rehab continues to provide that into one-on-one therapy medical care for those patients who have strokes, traumatic brain injuries, spinal cord injuries, motor vehicle accidents, debilities, hip and knee replacements. We're successful in continuing to follow that CMS or Center for Medicare and Medicaid Services admit criteria to accept those patients who are willing and able to participate in that intense 15 hours of therapy a week, which includes that physical therapy, occupational therapy, and speech. Our 24/7 medical support team consists of our nursing, our dietitian, pharmacist, and staff physician. All of them are working together in a multidisciplinary capacity to meet the patients' and families' goals and needs. I think the stay currently is 2 to 4 weeks, just depending on diagnosis and acuity. So for our chemical dependency unit, consists of our 3 separate levels of care for patients who are seeking a variety of seeking treatment for a variety of substance misuse disorders. We currently have 8 operational medical detox beds in which we treat those substance use disorders such as alcohol, opioids, benzos, cocaine, and meth. The care is directed solely by our medical team, which is 24/7 with counselors offering that inpatient education programming, critical discharge planning for their sobriety and sustainment. That length of stay typically ranges from 3 to 7 days. Again, it's dependent on their substance and acuity. We opened in July of 2018 our inpatient residential treatment program. It's a 28-day program which focuses on adults who are exploring extended type recovery options and sustainment through daily education programming and utilizing that multidisciplinary team approach. Goals include increasing patients' emotional or cognitive regulation by learning about the triggers that lead to their reactive states. We are diligently assisting them in locating, developing resources, tools, coping skills so that they remain successful in their sobriety. Over the past few months, we've been strategically successful in increasing our census as we identify improvements in our workflow processes as well as hiring staff support. Our IOP program, we currently provide 2 separate tracks of IOP. It's for those who are willing to participate in that outpatient treatment model who've gone through detox, our 28-day residential program, plug into our IOP. This also is available to those communities who recommended. We follow evidence-based treatment model, IDPT, in our education or programming to address that co-occurring disorder that's mental and behavioral health. So our clients currently they meet for 3 hours 3 times a week in a group setting and are offered that individual counseling session. So for our inpatient medical rehab, our census, it remains closely consistent with previous years. We've serviced 36 patients this quarter for a total of 74 patients the past 2 quarters. It's slightly above last year, as well as our total patient days. We did see an increase in the number of referrals that were lost due to variables such as patients not wanting to engage in that intense therapy or referrals that were sent over to SNF that offered some rehab services. Some of those were also lost to other inpatient rehab facilities in proximity to us. Our case mix index is at 1.10. It's slightly below the regional and national standard in comparison. Our challenge in this arena is providing some safety net services to those without the insurance when again unfunded, undocumented. That discharge planning is back to home. That this position is a little bit challenging for us. We try to find the resources and have to extend stays. So it also has an impact on our we did see an overall increase in the number of Medicaid patients this quarter, which included the non-funded undocumented patients that were serviced. Our length of stay is still holding about 15 days with an 86% success rate in our discharge back to home for patients to their community. Functional status improvement scores remain at 99%. 75th percentile of the nation, or 922 inpatient rehabs that were very against. Our therapy hours were slightly higher. Again, this is due to the acuities of extended stays and that discharge disposition. But we still remain consistent with our census volume and CMS requirements. CDU unit, our chemical dependency unit, it continues to grow, especially with the addition of our new FTE mid-level provider that in October, early November. We serviced a total of 68 patients this quarter, a total of about 118 in the past 6 months. So this is a significant increase to our occupancy and our programming. Again, our goals are to ensure that the patients are discharged and are reporting for aftercare appointments, going to that other level of care, such as a 28-day program and IOP. So that's holding about 90%. Again, those are volunteers, so we want to engage in that type of treatment. Our IOP program is averaging about 32 clients served, which is consistent with the max occupancy for the 2 tracks that we offer. We had a total of 7 graduates this quarter and 95 clients served total. Our IOP hours are consistent with the requirements for group and individual counseling. Inpatient social rehab has significantly increased by about 32% in census occupancy since July. We've serviced a total of about 75 clients in this 28-day program for a total of 31 graduates. Currently sit about 70% occupancy. With the rooms for improvement, we're going to identify workflow processes and staffing needs that are essential to obtaining 100% occupancy of that unit. We are communicating with HSD and the Medicaid Assistance Division about certification inclusion criteria for reimbursement and payment type of service. That's important. All right, accounts receivable. We're still diligently working our revenue cycles. Our improvement efforts are around insurance verification, our prior auths, utilization review, working our claims denials and rejections. Our efforts are to bill timely and accurately, because this is really our priority. But this quarter, we're slightly below last year's AR. We currently sit about 33% in our collection rate, although we have more billed out due to our increases in our service line. The challenge that we've identified is the more we do, the more seasons increase, the more staff we need. So, of course, that hiring that financial staff is going to be essential to helping us achieve and reflect the higher reimbursement. So we have that position posted, and we hope to hire an increase in the next quarter for our reporting. And that's just a snapshot of where we are at in comparison to the past 3 quarters. Capital projects. We're currently working with George Morgan, Denise Verdine on the 2 important capital projects that are underway for us. This includes our security camera system, a badge swipe access system, and our front entrance, exit, back entrance, and exit doors. The vendor has been selected for our camera and security badge access system. We met Tuesday of this week to kick off our preliminary rollout plans, our needs, our expectations, get more or less of an expected completion date rolling. Looks like we're going to meet back and reconvene about January 29th. And hope to have possible vendors selected for road replacement, so we can have both projects rolling simultaneously since they're going to impact each other. The other projects identified for future inclusion are the nurse call bell systems, medical beds, and external upkeep of our facility. Contract cost utilization. We're still nearing about $800,000 in our contract costs. Most of it's around mainly our direct care related contracts, Fusion, PT, OT, speech, our nurse agencies, Rapid, QRS. We continue to monitor the utilization and make necessary operational changes to alleviate any unnecessary utilization and increase costs. And our primary goal is to hire that direct staff support, our FTEs, in that direct care arena to increase the costs. Professional services in these contracts are needed for operations or regulations, compliance, and preventative maintenance. We are Joint Commission accredited. We are deemed status. We are in the survey window with CMS as a revalidation to our performance improvement activities. We've been following for the past year. Performance data with Joint Commission with CMS, we continuously improve and focus on direct care, patient safety, quality of care initiatives such as our ASAP treatment plan. We've identified an improvement opportunity into our detox to social residential treatment, our fall risk management improvement for our therapy patients, medication reconciliation. We've identified improvement efforts there to educate and to accurately give the treatment at admission and discharge. Pain assessments, stewardship programs are underway. Medication errors, we had a bit of an increase and now a decrease in that arena. However, we're closely monitoring it. We've got several initiatives underway for that arena. And off communication and our FIM score improvement, although it's at 99%, we want to remain proactive. We want to review, investigate those positive outcomes, how we can incorporate some of those improvement areas into our other programs. So our program surveys, we've ramped up on our rounds with our patients, including both administration, director of nursing, and quality director, and rounding on the patients on a daily basis to ask them, what are their needs, how are they doing, how's the treatment, how's their care, if there's anything we need to improve on. And you'll be surprised by the amount of feedback, the amount of changes, even to the smallest. Turn on the radio a bit, or the voice too loud, tweaking those little things to make the patient comfortable. That makes all the difference in the world. We currently sit at scores in the 90s. Human resources. We had some staff turnover in November, December in our direct care arena. It did increase our utilization of our direct care agency contractors. We're patiently working with SPO and HRB on those combat actions as soon as possible. We did hire 6 this quarter, 9 vacancies and 2 on FMLA. Needs and challenges of our facility and the needs in our region are mainly direct care staff. Although we've been successful in hiring a mid-level and candidates for a medical director position, our nurses and our tech physicians remain our hiring challenge. It's competitive out in our area, out in our environment, but it's still identified as a top priority. Those were just a list of them. So marketing, we're working with our 5th judicial district with their adult drug work program. We're looking to be certified in Chaves County sometime in June or July. This will be essential in developing our third track for RFP. We'll be meeting with our local hospitals, Eastern New Mexico Medical Center, to discuss inclusion into their clinical care model, which could positively impact our facility in terms of referrals and that preferred site for quality care-based safety metrics that are followed. Top priorities in our mayor council meetings include family practice physician and the recruitment of specialists to Roswell. We're experiencing a large number of physicians that are expected to retire in the next 2 to 3 years, which is going to have an impact on the community. So what we're doing is we're each hospital and stakeholders and other physician practices, we're bringing new hires that come into our community, where their marketers taking them around to each facility to meet with us, discuss services, treatment options we have. So to let them know that they're not alone in the treatment and coming with Roswell, but they've got all these great resources and backup. So that's going to continue. We'll be meeting continuously with UNM and some of their outpatient programs about referrals, some marketing strategies, and programming builds that we have going in the future. So as far as our
I know.
as far
An
as
eye test as
our
well. I appreciate it.
Our success and goals with our social rehab model, it's up and running as we're at 70%. Our goal is to be 100%. That's going really well. Our adult drug court, again, our aim and our goal is to get certified in July. It's going to be key with our IOP. Still our marketing strategies around probation for all offices, those legal court systems, hospitals, physician clinics, to build our stronger referral base is still essential. Revenue cycle management, as I spoke earlier, that's a top priority in the financial aspect or piece there. IOP, as I mentioned, that third track, is our goal in the next 6 months. We're exploring physical therapy and occupational therapy outpatient. As we look at project development, we want to see what the potential is for adding that service line onto our existing medical rehabilitation site. Neurology, looking at UNM and how they can we can work and collaborate together in a neurology type outpatient-based clinic to enhance our stroke initiative, our stroke care, which increases our strategy for referrals. Any questions?
Any questions for Melissa or
I have a question. Is there 6% of patients that get into they are what?
6% in which unit?
When you said 6%. 86% get discharged to.
Oh, back to home.
Yeah, and
Right.
then 6% went to
A higher
care
level.
hospital, acute care.
Yeah, those are usually
Because your population's only like, that's a pretty high number.
we had this quarter we had 2 which stroke developed some complications along.
They were already stroke patients? Oh,
They were
and they had
stroke-
complications.
Right. In which we had to refer back to a high level of care.
any other questions for Melissa? Moving to Fort Worth.
Thank you. Again, I'm Todd Winder, Administrator with Fort Baird Medical Center. This is our report for the second quarter of fiscal year 2019. A quick review of our services. Again, we are 200 bed duly certified. We have 3 units, our skilled rehab and extended care, which consists of 70 beds. Our dementia care unit, which is a 90 bed unit, and our veterans unit, which is 40 beds. Our licensing and certification, our last CNS or DHI survey was in May of 2018, so we're getting close to our window there. We've had no complaint surveys, on wood so far. Our Veterans Administration was in June of 18. We've had no complaint surveys there. Our Life Safety Code was in May 2018 as well. All compliance. We did a quick review of our utilization for the quarter. For the second quarter, we had 12,176 patient days. That's down about 14 from the previous quarter, with our admissions and discharges remaining pretty much the same. Our average daily census for the quarter has been 132, and our average available beds occupied. You can see my number there. And we'll talk on that later today. On our finance, our revenues and expenses for the second quarter, our revenues were up as well as our expenses with some unexpected fixes we needed to do in the building, which was the cost for that. This next slide shows our indigent services for the quarter at 764,000, just over 764,000. That amounts to the second quarter about 14% of our revenue are on indigent care. Our collections for the quarter was 82.4, with a year-to-date of 86.8. As has been stated by the others presenting, our financial staff due to retirements and people off ill, etc. We're having a hard time keeping up. The changes in the MCOs haven't been very helpful either, so it's made a big difference. In our human resources, we currently are staffed with 244 FTEs out of about 315. Our turnover rate for the quarter was 1.85, with a year-to-date of 2.8. In our FTEs, we have 51 direct care FTEs vacant, which amounts to 28%. Indirect care vacancies of 21 at 16%, for an overall vacancy rate of 22.8%. For our clinical data, our actual PPDs for the quarter was 4.15, with our activity being at 3.0. Then our bed availability was at 103. Infection control, we had total infections of 64. All of those were in-house infections, I think most of the UTIs. We only had 2 multi-resistant organisms. Staff development, we're working on our CMS requirements as we are already into phase 3. For those new requirements, we continue to in-service on customer service. Clinical competencies is a big issue right now, resulting from our past surveys. We're trying to keep up on those, make sure that where we need to be when we revisit, and we're continuing to work on our employee performance evaluations. Just some pictures and activities. This is a Fort Bear Christmas. We all got together in the different departments and decorated our courtyards with some different items. You can see Mr. Scrooge there. Our HR department has a really good artist. So some of their other things there. The residents really had a good time as well as staff. The next slide. This is our tamale festival where our residents got together and made tamales. Great success. We've got residents out of their rooms that hadn't been to an activity in months. And come down and make tamales. And they were really good. So. I bought one dozen, went back about 2 more. They also did their craft fair bazaar where they throughout the year leading up to the holidays, especially they do different crafts and they sell those for funds for their activities funds. Had a good turnout there. I can't remember exactly how much they ended up making, but they had some very nice things. We also had our employee recognition at Christmas time. Again, a lot of fun. We likewise had a ugly sweater contest. our occupational therapist must have won because he's one picture there. There's a lot of people sitting like really happy.
I was gonna say that.
And that's it. Do we have any questions?
Any questions for Todd? Thank you. Seeing none, we'll move to Turquoise Lodge and Sean Hartley.
So my name is Shauna Hartley, and I'm presenting the Governing Board Report Quarter 2 for Turquoise Lodge Hospital. We continue to provide adult services for individuals that have substance misuse disorders. We have 16 medical detox beds. The average length of stay for that program is 1 to 7 days, contingent on the consumer's clinical presentation. We have a 16-bed social rehab program, and those are for individuals who are basically medically stable and want to engage in a recovery program. We continue to be the vendor for the county's MATS program, but our clinic is called MO2, so it's Medical Observation Treatment Unit. We're open 365 days a year from 7:30 to 4:30 or until the last patient is seen. And we continue to provide intensive outpatient services, one track of matrix. Some of the highlights from this quarter is incredible change for our facility. I announced last governing board that we're actually going to be moving our facility to the Gibson Medical Center. And I'll be providing a little bit more update on that later on in this presentation. This quarter, we have also had a transition with our medical director, Dr. Mirren. Carmela and I have shared the same medical director for the last 5 years, and it was a tremendous experience working with him. He has moved on to another state. And so this quarter, I've been doing interviews. I've had a couple of good candidates. I actually met with my selected candidate for the position last night. And she'll be giving me an answer. So hopefully next governing board, I'll be announcing that we have a new medical director. Because we are leaving the current location, we will also be transitioning the MO2 clinic to UNM. And so come July 1st, UNM will be taking over the clinic. And so I've been working with them weekly, meeting with their pharmacy staff, their medical staff, having co-led meetings with the county to support the staff in the transition. And so basically turning over that product in the next couple of months. Our data remains pretty consistent. We do about 100 admissions a month. We actually had a 3% decrease in our occupancy this quarter, but that was based on the increase in our social rehab beds. So basically those beds don't turn over as quickly when individuals are participating in our 21-day program. Our demographics remain pretty much the same. We did have a decrease in white Caucasian, other Hispanic, increase in white Caucasian, not Hispanic this quarter, but for the most part, our demographics remain the same. In regards to our age distribution, we actually had a surge in 21 to 30-year-olds, which is always an interesting experience. We had a decrease in our 51 to 60-year-olds, and we are becoming more versed in actually looking at that data on a weekly basis and making program adjustments because, as you know, there's a pretty big difference between 21-year-olds and 51-year-olds, and we're becoming better versed in that. Our primary drug of choice remains pretty much the same. Primarily, the individuals that come through our hospital are detoxing primarily from alcohol, secondarily from opiates. Those demographics don't mean that individuals are not using multiple drugs or alcohol, but that's the primary protocols that are being used to detox the patient. This is my contract cost for this quarter, and I am proud to announce that this is the first time in 5 years that I have had 0 agency nursing contract dollars used. So yeah, this has been fantastic. So that surge in improving the wages for nursing has really, really paid off. I'm also putting a pretty diligent effort into retention with the nursing staff that we're actually hiring so that, this can have some longevity to it. But at this point, compared to last quarter, we were at 14,000, and now this quarter, we are at the red 0.
Have you always contracted security? It's never been hired?
Yes, because we lease the building from the county, and we actually share a couple of different contracts with them. So we share security, and we also share the food vendor. Our outpatient data has actually, our numbers have improved. Partly our group encounters, we actually did about 100 more from last quarter, and that contributed to basically us starting a family program. So we've actually added, instead of individuals coming 3 days a week, they're coming 4 days a week, and then the family component. We average, as far as our MOTU numbers go, we see about 1,200 to about 1,500 people a quarter. We were about 200 individuals down, but that's not unusual with weather. There's a pretty direct correlation between colder weather, less patients. But we continue to see a large number in the social detox program for the county. We have had a spectacular quarter financially, probably the best one that we've had in quite a long time. And it's been partly due to, because we are currently not accredited, which we would be seeking in our new facility once we transfer. Right now we are identified as an IMD status with a 99226 code. And so there's been some challenges with the MCOs actually converting that 99226 for billing purposes. So this surge in revenue is really based on that actually getting completed with all 4 MCOs. And so we're starting to see the benefits of that, and we'll continue to do so. So the update on our facility location is that we have completed the set of architectural and life safety drawings, and that's been quite a schooling process for me with the assistance of George Morgan. I've learned so much about doors and hardware and square footage and height, more than I probably ever wanted to know. We have finalized our lease at Gibson. We do have a tentative move-in date of March of this year. However, George and I attended a meeting yesterday where the contractor, our landlord, and the architect will be presenting a new schedule to us. So next quarter, I'll be more clear about that specific date. I'm in the process of securing all the resources for the move, and so that entails identifying a mover, looking at a new vendor for food services, really putting together that whole process as far as the resources I need to move, but also a comprehensive transition plan for the patient, staff, and our community stakeholders. We have a tentative plan put together. It's probably going to be approximately a 2-week process. Obviously, starting with the individuals who are not direct care providers, which is, for example, the finance department, the medical records department. We do plan to move our facility occupied. And really the only glitch on that day is that we probably won't do admission. So I'll have a better plan to present next quarter.
Is the capacity the same as 32?
We are actually, at our new facility, we will have 8 beds increased on 4 beds on each side. So I'll have 4 extra medical detox beds, 20 and 20. And then I'll have a whole separate area for IOP, which will allow us to actually pursue a MATS clinic, in addition to several tracks of IOP, because where we're located now, we kind of had a makeshift area where we do intensive outpatient. It doesn't really give that space, so I'll be able to grow on both ends. The marketing and outreach efforts that we made this quarter, we continue to engage with the community. We have gone to several different events, and I think because of the efforts put into PR over the last year or so, we are starting to be invited to the big shows, as I call it. The New Mexico Leaders in Recovery dinner we were able to attend, which is a pretty big deal. And we're starting to be invited to quite a bit of activities and be leaders in the recovery community. So really, really proud of that. This quarter, we had a beautiful evening of gratitude. This is a picture of all the volunteers that volunteer at our hospital. And one of the things that make us unique, I believe, is that we have really great relationships with stakeholders such as AA, CA, Pills Anonymous, NA. The individual with the long beard, that's Donald Hume. He does double trouble. He's actually been volunteering at our facility for the last 25 years. Some of the individuals in the picture are from UNM. We have a collaborative with the mindfulness PhD program at UNM, and they come in and do groups 2 days a week and then Wings for Life. So in December, we decided that we wanted to give back to our volunteers, and so we got with the patients and we actually designed a whole evening. What we did is we created a beautiful dinner setting, which you'll see at the end of the presentation. But each one of our patients actually made an individual place setting for every one of the volunteers. And the sequence of events for the evening was that we provided everybody dinner. We then lined up all the volunteers, and each one of our patients actually read a message of gratitude that they feel when they actually attend their groups. We gave them a pin. And then our patients sang really groovy Christmas songs to them, and then we had cake. And it was really, really beautiful, and I wish I would have done this a lot of years earlier, but we're gonna start doing this probably a event for the volunteers every quarter, but a big event most definitely every year. Like my peers in the room, we did a lot of staff engagement activities this quarter, taking advantage of the holidays and celebrations. We did an ugly sweater contest. We celebrated breast cancer. All my staff wore pink on that day. We did this really great activity for Christmas. We had an affirmation Christmas tree. So we took all the letters of each staff person and then we divvied them out to everybody, and everybody had to come up with something positive about that person. And then we made these really great ornaments and displayed them throughout the holidays, and so that was really nice. And then we had our traditional staff appreciation dinner that we normally do each year.
Christmas tree dress, APD Congratulations to her.
Yeah, she was an actual Christmas tree. It was really, it was very, very moving. So with our HR information, we stay pretty steady around 27 to 26, 25%. But we actually hired a lot of key people this quarter, which was nice. So like Carmela talked about, we had been sharing an HR director, and we both realized that we probably need a little bit more than a part-time individual. And so the person that we hired is actually going to stay at my facility, and we did interviews at her facility a couple weeks ago, and we identified a really good candidate. So I think we both are winners. We hired a housekeeper, a nurse supervisor, and a clinician. So I'm trying to really build my clinical department in anticipation of going to our new facility and growing our outpatient services and our continuing care. And then we hired a LADAC. So that is the image of our volunteer appreciation night. And those are all the individual place settings that the patients made, and they got really, really into it, and they made this really great sign. It's kind of hard to see back there, but we had a really good artist that also decorated the area. So I don't know if you guys have any questions.
Thank you. Okay, having heard all of the facility administrator reports, can I get a motion to accept them collectively? Your
Motion.
Second.
All those in favor of accepting the facility administrative report, say aye.
Aye.
Anyone opposed? We will move to the program area 6 financial.
Okay, the fiscal report that I'll be reporting on is for a period ending December 31st. Our projected FY19 deficit is 2.6 million. FY16 actuals finished the fiscal year in a 3.1 deficit. And the FY17, our actuals, we finished a surplus of 3.2 million. And FY18, our actuals last fiscal year, we finished with a surplus of 2.1 million. Okay. The next slide, it just shows all facilities FY19 operating budget and broken down by revenue sources. Our general fund is at 55.5 million. The Fort Bayer Medical Center lease is a little bit over 4 million. Interagency transfers, which comprise land income, 4.4 million. Federal revenues, which are mainly our Medicare revenues, is 5.1 million, and our other state funds at 58.7 for a total operating budget of 127.8 million. The next slide, I'm not going to go through it. All it is just a breakdown of all of our facilities to include OFM, and it's broken out by expenditure accounts at a high level from 200s, 300s, and 400s, and by our revenue streams. Okay, the next slide has to do with our facilities performance measures for the first quarter from July through September. In FY19, our target for the percent of eligible third-party revenue collected at all agency facilities was supposed to be at greater than or equal to 93%, and our first quarter is at 72.4%. The number of significant medication errors per 100 patients, we should be at less than or equal to 2, and our first quarter actual was 0.4. The percent of long-term care residents experiencing one or more falls with major injuries, we should be at less than or equal to 0.5%, and we are at 4.9%. And with that, that concludes the facilities fiscal report, and I will stand for questions.
I'm not sure if we will be revisiting performance measures, that there may be some changes, there's no new administration and that kind of stuff. But I know we were trying to come up with a way for them to be national measures. I also know it's difficult because you all have very different populations, and everyone continues to want to put you all in the same category, facilities. So we'll continue to push and figure out how we can do that. So can I get a motion for approval of the Area 6 financial report?
Opposed.
And second? All those in favor? Aye. Anyone opposed? The financial report is approved. And I'll actually go over the approval of policies. So these policies would have been provided to you as a governing body before electronically. We have policies from Sequoia. I think there were also policies from NMRC and the Mexico Behavioral Health Institute. So if anybody has any questions about the policies or concerns about them, please raise them now. If not, I will entertain a motion for approval of the policies that you all should review before coming today.
I'll make the motion.
Can I have a second? Second. All those in favor of approving the policies that were presented to the governing body? All those in favor?
Aye.
And anyone opposed? Policies will be approved by the governing body. And these of course all go through the Office of General Counsel as well. They're required to submit to the credentials report.
Good morning. So I think we I know that Michelle feels is most of the work on this, and I'm just here to present it, but we have, and this is my first time, so I'm sorry if I don't get this quite right, but I believe I am supposed to request a motion to approve the credentialing. There's a list of providers in the facilities that have been reviewed by the medical executive committee last week. There were no serious issues, and so we have a list of providers that potentially diligence and barriers. Madeline Patel and Pradeep Shankar. There were none from Los Lunas, NMDOH, we have Amanda Batera, Catherine Boyd, Kristen Hansen Sudell, Sally Ann Haynes, Andrew Keyes, William Murphy, Mary Winger, Earl Russell, Rachel Trujillo, NMRC, Balas Patieta, Stephen Hancock, Indiana Ulum, Michael Bodanis, from Public Health Division with Mary Seiss, Sequoia Dinah Kotova, and Hoosier Horse Lodge, Brian Kimber, and Jeff Lewis. And I'd like to request a motion to approve action with these providers.
And a second,
Second.
all those in favor of approving the current department for medical. Say aye.
Aye.
Anyone opposed? None of the reports. Thank you very much. We also, as you all may recall, annually are to look at our governing body bylaws. So those were also sent to you to see if you have any recommendations for changes. I'll also, of course, be presenting these to the Cabinet Secretary and see if there's any changes or recommendations that she has. But we always want to make sure that we're continuously reviewing these bylaws and see if there's anything that needs to be amended or other things changed. So does anybody have any recommendations for changes or amendments to the governing body bylaws? Seeing none. We're also supposed to do one of our responsibilities is to do a governing body self-review. We do have minutes, of course, from all of our meetings that are maintained. Office of the Secretary. There were, all members were always in attendance. We didn't have any issues that came to the governing body that needed any particular resolution. We're going to continue to look at the performance measures in terms of how we can improve them. And when we have, for the financial collection, we have a special project looking at the financial positions of the different facilities to move that forward. And just information sharing. We, of course, have a new director at State Personnel. We have a new, or Cabinet Secretary at General Services Division, new Cabinet Secretary of Children and Families, and a lot of the agencies that interface and impact the work that you do. So the Cabinet Secretary, the other Deputy Avinash and myself have been meeting with these folks just to establish a relationship first, tell them some of our priorities. George did an excellent job with the General Services Deputy Secretary in laying out some of the department's initiatives and asking for clarification on how they want things to move forward. So I just want you to know we're having those conversations. I'm trying specifically not to overwhelm the State Personnel Director yet with a lot of very specific requests, but forging that relationship and trying to make sure that we have certain blanket approvals, asking about other memorandums that went out from the past administration to see if those are still directives that we have to follow. So I'll just say she was extraordinarily receptive. She was really wanting to be creative about the way she looks at things, including recruitment. So I think it's fair to say that we were very excited, you know what I mean, about the first meeting. There's a lot, you know what I mean, for everyone to do. Of course, we're also in a legislative session. They just walked in the door, so that was fun for people. So we'll continue to, I also asked you for a list of all your critical vacancies right now. I'm going to try and move those through the process as we have our bi-weekly meetings with our HR department and pick up where we left off on the financial positions initiative. And, you know, and just keep pushing things forward for you guys at that level. I just wanted you to know that we are having those discussions to try and resolve. Because I think if we looked at, as a governing body, we don't necessarily have any issues that came to us, but certainly the facilities have been struggling with filling vacancies, wondering what was going to happen with consolidation and how it would impact you and all those kinds of things. So we're moving to get resolutions as quickly as we can, understanding that they have a heavy lift. So just information sharing with you guys. If you have anything else that you want me to bring forward to the Cabinet Secretary or to other divisions or departments, please feel free, like you always have, to send emails to me at our check-ins, whatever it is, because I just want to clear at them. I don't think, does anybody else have anything they want to talk about in terms of the governing body self-review? It's on page 5 of 8 of the governing body bylaws. Seeing no further discussion, we will move on then to announcements. We have kind of put one as well. That's okay. Yeah. But I think you should do it fun because I just want you to be able to tell them a little bit about your background. I'm very excited.
Well, that's easy. I know about myself.
Yeah.
You know my name. I am a board certified cardiologist, and I've been in practice at the university and an associate professor there. But I do have a public health background. I used to work for the National Health Service in the United Kingdom, and also for the World Health Organization. After I did my public health training, so I've been in as well. And I am. It seems like in our office, I'm doing most of the population health stuff. But I want to attend this next time too. Is this in April?
Yes.
Just because this was the best way for me to understand what the facilities are doing and what your needs are. And this is a really good summary. So I'm going to see what that means. And I want to see what the spring social calendar is.
I want notice before though.
You're gonna get invited.
Exactly. I want to be invited.
But thank you for having me.
Thank you for coming. I appreciate it. So the next meeting, of course, is Thursday, April 18th at 10 a.m. I'm hoping now that we can do some travel again. And so are there any volunteers outside of Albuquerque who would like us to visit your campus? Want to speak about it? Get back to me. We have a program. But it
We could do our Roswell.
It would be nice to
Yeah.
go somewhere else and see what's happening.
We should have our cameras and read orders.
So off in April.
Yeah.
Are you talking about the city governing board meeting?
We in the past we've tried to travel to each of the facilities at least, once a year.
Mhm.
And I mean it's especially a burden. Todd comes all the way usually from the Silver City area. And so I think we haven't been out in a while. It'll be a good idea to get back. Yes, but we always have a call-in number and we're always on Skype. And so there's different ways to attend. Well, we'll work on that, but I appreciate that percent. Just so we can look into it being held in a different location in April. And the snow should be melting. So before we adjourn, we'll adjourn just to a closed executive session and discuss any personnel or other issues that we might have to address during that executive session. We will not, during the executive session, to vote on anything that would need to be done in the public forum. And so we'll adjourn for that. Okay. We're coming back into our public session and just want for the record to indicate that we did not take a vote on anything that would be discussed in the public session. We have concluded our governing body meeting, the Department of Facilities and Community Program, and I would take a motion to adjourn this governing body. And second,
Second.
all those in favor?
Aye.
Anyone opposed? We're adjourned. Thank you very much.